Hello, I am Rogerio Pinto. I am the Associate Dean for Research and a professor at the University of Michigan School of Social Work. Last spring, I began a series of online forums about the COVID-19 pandemic and issues of stigma. Who was being affected by the pandemic? How were they being treated? What abiding inequities were suddenly being highlighted by the pandemic? The state of Louisiana was an early COVID hotspot with dramatic spikes in numbers of cases and death in early April. On April 30th, I gathered a number of scholars and activists from Louisiana to discuss the pandemic situation there. For some activists, COVID recalled the worst years of the HIV pandemic, and so HIV and LGBTQ plus issues became an organic part of this forum as well. I hope you will enjoy this rich and far-ranging discussion. I would like to thank all of those who originally participated and thank you for watching.
I'm a PhD candidate in African and African American Studies at Harvard. I'm also an organizer in New Orleans with the groups Take 'em Down NOLA and the New Orleans People's Assembly. And I moonlight as a French Quarter walking tour guide. And so I am coming to you straight from the 8th Ward of New Orleans right now, which we should acknowledge is stolen land, originally goes by the indigenous name of Wancha. And so in terms of giving some historical context, I wanted to talk about certain ideas and social structures that have reproduced racial difference and hierarchy in New Orleans really for centuries. And one thing I'm noticing amongst local historians is that they make comparisons, particularly to yellow fever plagues of the 19th century in New Orleans, during which the city ordered quarantines for a total of 23 years, to give an idea of how often and how severe plagues ravaged New Orleans, particularly coming from the port, coming from sailors, coming from slave ships all over the world. And so what local historians are doing right now is they're kind of doing this historical narrative as comfort thing, and using an adage that's like, we've gotten through this in the past, we'll get through it again. I disagree with that. And I want to go deeper, and I ask the questions, who and who is not included in that resilient we, and why? And so actually, if it's okay, I brought a little image to show you that that I thought actually encapsulated all these ideas really well instead of talking too much. And I'll hold it up. It's this picture right here. I can send it out to the group on a link as well. But basically, what it shows is it shows two Black men carrying a dead body. And what's happening with the plagues is that there are new and expanded racialized work that comes from this idea of statistically manufactured Black immunity. So journalists in the 19th century write about Black people, about newly arrived immigrants living in abject conditions. Doctors and nurses won't even go to treat them. They leave them to die in their homes. And so then they're left uncounted in medical and government reports that then say, oh, Black people, Irish immigrants are immune because we've had, no reports from the doctors and hospitals who aren't going there. And so then, because Black people could be both immune and statistically disposable, the work of handling contagious bodies becomes racialized. And then, as I mentioned before, we have indigenous communities who are completely absent from anecdotal and medical reports, who suffered from European disease long before the official founding of New Orleans. And in terms of these 19th century narratives, they're considered always and already disposed of. And then to kind of create that racial difference, we have the idea of white people, particularly white women, being protected by legally issued 19th century social distancing. And we can see this in city ordinances that require families to observe funerals from a distance, or even observe them from outside churches. The wealthy white families primarily are not allowed to go near bodies. They're not allowed to handle dead bodies. So these legal protections, they calcify and they naturalize white fragility, particularly white female fragility. We also see this in documentation of migrations of widows outside of New Orleans into the Cajun coast, into the river parishes. And then again, in this picture of kind of a funeral, I'll send the link, we see nuns and priests who can be close to the dead bodies. There's this idea of sort of divine immunity. But what I'm interested in is the message this is sending about whose deaths were worthy of recognition by the governing body of the Catholic Church, and who could be afforded dignity even into death. And I think that this could be really most starkly seen in what is going on with our hospitality workers in New Orleans, who basically run the city. And this is, again, disproportionately affecting people of color, and primarily the working class New Orleanians, who, again, are exposed, the most exposed, are serving it's increasing a wealth disparity. And this also feeds into issues that I've been noticing, and this is one thing I've been hearing about in particular, of kind of the same communities suffering during Katrina that we're suffering here, particularly folks in the lower Ninth Ward, not only cut off from easy food supplies, cut off from the transportation isn't running to get to work if they have hospitality industry jobs, and also access to medical care. It may take someone 2 hours to get from certain underserved areas of the city to a hospital to begin with. So there are structural things still that are kind of reinforcing disposability and who has to go to work that involves exposure.
Yes, I'm seeing the disparities. And where I work is actually, Louisiana is 2 states. There's the northern part of the state, and then there's a southern part of the state, which is along the I-10 corridor. The bulk of the population is along the I-10 corridor. But I work in the part of Baton Rouge, the Baton Rouge area, that's on the west side of the Mississippi River, the west side of Interstate 10. And when you cross the west side of the river, you've basically moved into another country. I mean, we talk about, people see New Orleans kind of as Louisiana. Well, the other face of Louisiana would be Baton Rouge. Nobody talks about the rural areas. Agriculture is still, they still have agriculture there. But the other thing you see in terms of the racial disparities is the preponderance of plants that are in or around Black neighborhoods and poor Black communities. And the state companies have the right to take your property to build a plant through eminent domain because it's in the public good. And so you have these people that are poor and Black that are sitting on top of these plants. The EPA, there is no EPA here. There is no Department of Air Quality here, really. And so in places like St. John the Baptist Parish, they have one of the per capita highest proportions of deaths in the country. There's a nursing home that's been devastated. Now, the one thing about St. John, and when I'm talking too much, tell me if I go on too long. And so the thing about St. John the Baptist and the deaths there, that it's been, whites have been dying in St. John, but there's a veterans home, a nursing home, where a large number of the deaths have occurred. And then we have some leaders. This African American leader told me one day, I'm afraid to answer the phone. She said, because every time I answer the phone, somebody I know or somebody that has my family, somebody has died from the disease and virus. And so it's been very devastating. Harvard, there's a research paper I'd like to get a hold of, done by some Harvard researchers that surmises that the reason that the deaths are so high in places like St. John and St. James is because the particles, the pollution particles, are smaller and easier to get into your lungs and into your body. And then I'd like to, so that's St. John the parish. I work in 4 parishes. I'd just like to describe another parish, Point Capee, which is more New Orleans than it is Baton Rouge, even though it's right outside of Baton Rouge. More New Orleans, more French than again, more New Orleans. Point Capee it's one of the poorest parishes in the state, and it has a growing Spanish-speaking population, because now African Americans do not work in the fields. They don't want, that's not a job that African Americans have done. And so there's this influx of Spanish-speaking families into Point Capee, but they're very isolated. A lot of them are monolingual Spanish-speaking. Before the virus hit, clinics have refused to see them because, they said, we don't understand Spanish, and so we can't treat you. And so they've literally turned people away. And then there's fear in the community because there's not a lot really of information in Spanish. And we're trying to address that, but that's the other dynamic that's happening on the west side of the river.
I think that kind of what we're hearing from Robin and then in what Lady is sharing really points to what I think is really important about understanding the effects of COVID here in Louisiana, is that these disparities were here before. So what the virus and what this pandemic is doing is shedding a very bright light on health inequities and structural inequities that were going on for centuries before this. And if you look at the mortality rates, the white-black gap in mortality rates by diseases that are the major risk factors for mortality from COVID, we see a great disparity and a higher rate among both whites and Black people from before the pandemic. And so I think it's unfortunately unsurprising that we're seeing these disparities here today, and I think they show up in everything, including in the in the deaths of essential workers and who's still working, and then also I think other things that we're newly contending with is really kind of the larger impacts on this, on the immigrant working population and people that are have a lower access to information about the disease, because information, multilingual information, hasn't been fully accessible from the state. And so I think we're really kind of coming to understand the impacts of this among other communities. It's also important to highlight that there have been real efforts by organizers and a lot of people in the area to work to deal with and address these structural inequities from before this pandemic, and that there's I think renewed bigger and hopefully a moment of opportunity, including the formation of a health equity task force by our governor to try and look more closely at what's going on.
Yes, my name is Khalid Hudson. I'm originally from Chicago, Illinois, and don't hold this against me, but I'm a graduate of the University of Iowa, so I am a Hawkeye. For those that are Big Ten fans and whatnot, but so I've been organizing in Baton Rouge with Together Baton Rouge for about a little over a year. I started off organizing in Jackson, Mississippi, which is just about 2.5 hours away from Baton Rouge, and I was asked to move here to Louisiana um, to participate in a huge fight. Together Baton Rouge was and Together Louisiana was in the midst of a fight with the largest industry in the world, the oil industry, around the disparities that these entities do not pay taxes, right? And so that, and the reason why we're in this fight is because our communities are under resourced, right? This is something that is well known about many states, but in Louisiana in particular, you can have a zip code that is the wealthiest zip code because of the oil industry, but then be the poorest zip code where you're dealing with communities that do not have grocery stores. You're dealing with a failing transportation system. Those same communities do not have access to primary care and a host of other things that fall in line with the social determinants of health. So then when you're faced with a pandemic, all of these aspects of the social determinants of health come into play, right? And early on, when we first went into this shelter in place, a group of leaders and myself, we went to meet with the mayor of Baton Rouge to discuss kind of what was going on or how was she thinking about the coming pandemic that we all were starting to anticipate. And one thing she brought up was that she was concerned that the when tests were administered for COVID-19, that they were not noting the race of who the test is being given to.
Mm.
One of the reports that is started to emerge is the disparity around who has access to be tested, right? And so that helps to perpetuate, as it was stated earlier, perpetuate this myth that somehow melanin was the protection against COVID. But we just didn't know, right? We just didn't know how fast this disease was spreading through our communities. It was probably here well before any of us have ever thought about. I mean, beyond even Mardi Gras. But that was a concern of the mayor and a concern that the organization shares is that, how do we know that there's some equity and equality in an administration of tests that every community, particularly in the beginning, had limited access to? And so, but then we all wake up and start hearing these numbers around 70% of, the deaths around COVID are that of African American people. Um, and it draws to mind actually a story or engagement that I had just a couple days ago. There's a leader here named Lionel Brazil who I hadn't called in a while because I know that he was taking on a greater responsibility with his aging mother. But he was on a meeting, on a call 2 days ago, and what he shared was that 6 of his family members are dealing with COVID. 6 of his aging family members. That he has a nephew that had flu symptoms, came home to his mother and father to recover. Now he just thought that was a flu, right? He had not been tested. He went home. Both his mother and his father got sick. The gentleman and his father has died from COVID. The mother is just returned home from recovering from COVID, but she's lost her husband and her son as a result. Um, and then there's 4 other members within his family that are currently dealing with the COVID. And what he said yesterday was, the media is talking about the disparities, about how this is impacting the African American community. My family is a testament to that. We're dealing with that right now, you know. Um, and that's the reality. I think that along with just statistics, you're seeing the faces of people that are struggling with this, but you're also the amount of grief that everyone is carrying right now. We just had a clergy meeting earlier today, and we've been having some over the last few weeks, where clergy are kind of grappling with just the amount of grief that they're carrying. The fact that they're the only ones or a few people that could bury someone, that they can't get in contact with some of the older folks that don't have access to Zoom and computers and internet. And so there's just there's a lot of work to do. But what we're choosing to do with our time and our organizing is that there has to be a group of people that are organized and thinking about and casting a vision of what society will look like after we come out of this. Because one thing we are very clear about, that the world that we knew a few months ago does not exist anymore. And so how do we participate and build the capacity and build the power to help shape the world that is going to come?
I'm Leon Golson, Director of Prevention Programs for Unified HIV Health and Beyond. Been conducting HIV prevention in the state of Michigan for about as long as I've been living with it, which is 30 plus years now. So I have that I can kind of reflect on. I'll talk from my agency's perspective. And from that perspective, we're definitely putting our clients' health and safety first. So right now, we are not having clients physically come to the office because we are not prepared, but we are gearing up to prepare for that. We actually had an all-staff meeting today, and we're projecting our open office day where clients will actually physically be able to come in will be June 1st, if all goes well. So in the meantime, we're working on pulling together procedures and protocols on what a client visit will look like, if that's, regardless of if that's for case management or for HIV STI testing. The challenge is trying to secure before June 1st all of the safety equipment, personal safety equipment that's needed, and all of the cleaning materials that's needed. That's a big challenge, but we are trying our best to shake the trees and see what we can get so we're prepared come June 1st. Our state health department is, of course, well aware of what's going on and how it's impacted its funded entities, and they are trying to be as supportive as they can be, given that they're are also focused on, COVID-19 for the state. They've actually got set aside some virtual FaceTime with their funded partners to answer any questions, concerns, provide any technical assistance that an agency such as ours will need. With regards to the LGBT community and interacting with them, we've been using our social media platforms creatively to try and keep in touch and stay in touch with our clientele, our consumers, our clients. We are trying to do as much virtually as possible. We're giving some thought to in-home HIV testing in the near future. We'll also be wanting to move an intervention that we're currently running face-to-face, which was called Healthy Relationships. We're going to try and do that virtually as well. I know for me personally, this has brought up some mixed feelings. Some feelings I thought I had put to rest, resurfaced. One particular incident that sticks out that I'll share is when this first started to come to a head, and we were trying to figure out what we we're going to do with testing, if we were going to continue it or not. One of my team members said, well, Leon, why don't we buy those face shields, and then we can do testing, and we can, gown up and gloves and all of that. And I cringed because it reflected back to the early days of HIV infection. And I'm like, I wouldn't want to have someone coming into a testing situation, like that. So I was a little caught off guard at how that really impacted me. Since then, unfortunately, we're going to have to look at considering putting those measures in place if we want to continue some physical interaction with individuals.
Mm-hmm.
Our testing technology now, of course, cannot be done virtually. So we'll see where this all goes. We're trying to, as I said, be as creative as possible with our social media to stay in touch with our communities. We do have some syringe access programming going, and we're doing that, keeping in mind the 6-foot distance. We have a mobile unit that's parked out in our parking lot, and our lead person in charge of that sets up appointment times for individuals to come to the mobile unit and get whatever they need with regards to syringe access.
Yeah, so I also am living positive since 1984. So I have that relationship to the mask and the gloves and everybody coming in and quarantining and nobody wanted to breathe your germs. I mean, honestly, though, I went into the supermarket and that's how people looked. So it might actually be easier to do, but it could take you back. The other thing that I was thinking that I connected to when you were talking is this kind of very casual, the fact that everybody can go online. Right. So you were talking about doing a workshop online. One of the things that has we become very aware of that I think we've kind of taken for granted is that there is still a huge digital divide in this country. And the assumption that, cell phones take care of everything. Because almost everybody does have a cell phone. They don't have unlimited data plans. People are kind of like, when we're saying, oh, we could do your counseling session over the phone, and people are like, yeah, that's an hour of my, because a lot of our low income clients just have basically minimum service and minimum data. And so although during COVID, most of the providers have kind of extended that for the Lifeline clients and stuff like that. I mean, I just, when we said to kids, oh, you can do online learning. Not really. There's a big difference between a cell phone and a computer. And so we have just become increasingly, I'm in New York City, very aware of the digital divide as we so casually said, oh, we can do everything online, and everybody can't. And then the other thing I would just say, as somebody who serves a lot of LGBT homeless young adults, is that, they are very much group animals. Their whole support system and way of life is very kind of social and interconnected. And some of them are really, really struggling, even though they have their own units. Isolation is overwhelming them. And we have restricted, to no more than 2 guests. And that's just a very, very different way of life. And I really do think that they're leaving the building and putting themselves at risk just to be in more social situations.
Yeah, I just wanted to thank you for bringing up the digital divide and technology just generally. I mean, I think this really connects back also to what Lady was sharing with us earlier, is there's just so many communities, particularly in Louisiana and in the broader Gulf South, where it's not only like lack of access to computers or phones but also to broadband in general, where people are able to actually get online at all. And so sometimes, even though there's been the public libraries in Louisiana have left their Wi-Fi's on and you can go to the public library, but for some people that's, like a half hour to an hour drive. And so I think that piece, when we're thinking about working online, as well as telehealth and telemedicine, and a lot of the things that really intersect with a lot of what a lot of this community does, it's really important for us to pay real attention to an equity focus and an access focus with what that means. A reminder that we're also about a month out of hurricane season for those of us in the Gulf South. And one of the things that I found interesting is the way that the people cope with this. I cope with this, we all cope with this in ways that are very similar and very different from dealing with hurricanes and dealing with natural disasters, and that there's a certain sense of a disaster having happened, but none of the visible markers that we normally see. And people overbuying white bread in the grocery stores, but that not really kind of being what's needed in this moment. And so I think just this access to technology and broadband and internet is really something that we really need to think about in our broader conversations moving forward. And then and continue to think about as these as we move forward, kind of going through this, and just kind of be curious about too how, if there are storms this season in the Gulf South, like how those then further isolate communities if this is the way that we're connecting to healthcare and to each other.
I just added one note that, I did hear, and I do understand that not everyone has access to, the virtual world. So one thing that I'm going to be asking our state health department, since they're being very creative financially, is if they can support us or, their funded partners to provide, that needed technology for individuals who may not have it or it's limited in some way. So I'm going to ask if they are willing and able to support, our outreach efforts virtually, so that we have a less of a gap between those the haves and the have-nots when it comes to that.
Oh, great. Yeah, I'm Beth Sherman, and I teach at the University of Michigan School of Social Work. And when Rogerio asked me to speak on LGBTQ plus issues today, I just told him that I had just talked to a mother of, I have a 19-year-old daughter, and some of the students are home from college. And so I was talking to a friend whose young daughter is home and is just coming out as a lesbian, and involved in her, dating this a young woman at school. And, she's in a very safe, and when they had to come home, my friend's daughter is in a safe and supportive household, but her girlfriend is just going, where she was just coming out, is just going home to a very adverse situation in terms of the family being very anti-gay, and just the amount of surveillance that she's experiencing and her fear that she's going to get thrown out of the house. And there's really, it's often a fear with young people. I mean, there's such a high rate of kids getting kicked out from their homes related to gender and sexual orientation. But so she's just so afraid she's going to get thrown out of her house, or her parents won't pay for her education, which again, of course, that's a privileged situation, but just that real and present fear that for some young people, again, being out of the house, is a lifeline, and that many kids sort of survive their families and then try to find communities when they get older, and just, with people having to return home or not having other places to go, a lot of times they're returning to adverse situations and that isolation and surveillance. I believe it's Cancer Network for LGBTQ Populations wrote a really comprehensive report on COVID, and they made several recommendations that every organization think really specifically, as always, about LGBTQ populations in terms of their messaging, because for all the reasons we've talked about, with the social determinants of health and lack of access, that's of course just being exacerbated in this pandemic. Just that there are very specific recommendations about messaging, particularly to LGBTQ populations, because they're just, a lot of LGBTQ people have very difficult relationships with healthcare providers, in terms of discrimination, not being recognized, not having their pronouns or their identities respected. So just very particular in terms of equality and inclusion. And this is just a time where there's so much underhanded things going on because we can't pay attention to everything. And so the move to roll back the Obama's administration's equity of access related to gender identity and sexual orientation is there. I think that there's a report being released that's going to roll back that protection, and so it's under the while we're paying attention to other things, that kind of stuff, those kinds of moves are being shot. Okay, so so just in any way, and just particular organizations and activists doing very particular messaging around GLBTQ people.